Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Today on Community Health Heroes, we'll be talking with Valerie Wayto Johnston, PhD, Assistant Professor, Department of Psychiatry and Behavioral Sciences, Tulane University School of Medicine, and a consultant at Louisiana Children's Museum, who will talk about how our kids are handling stress in the post-Katrina New Orleans area. And American Heart Association representative Dr. Donald Adams, neurologist with East Jefferson General Hospital, who will discuss the latest stroke statistics in post-Katrina New Orleans. Dr. Keisha Davis, Louisiana Department of Health and Hospitals Assistant, State Health Officer, and Chief Medical Director for the Office of Public Health, who will talk about the state's Shots for Tots program and the importance of immunizations. And owner and chef Johnny of Yuki Sushi, who will prepare healthy and delicious sushi for us on today's Eat Fit NOLA cooking segment. So don't go away, we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to...
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards!
Oh, don't. Oh.
It went into Bob and Carol's yard. Oh, no? Okay,
Yeah.
here it goes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you.
Let's go.
Search We Can for more ideas on how you and your kids can get healthy together.
Welcome back to Community Health Heroes. As we approach the 10th anniversary of Hurricane Katrina, there are many studies recounting the stress faced by adults during and after the devastating storm ravaged our city. But what about our littlest citizens, the children? How are they doing? Here to give us an update on the emotional health of children in post-Katrina New Orleans is Valerie Wayto Johnston, PhD, Assistant Professor, Department of Psychiatry and Behavioral Sciences, Tulane University School of Medicine, and a consultant at the Louisiana Children's Museum. Welcome to the show, Dr. Wayto Johnston.
Thank you for having me.
So can you tell me, how are our kids doing in New Orleans 10 years post-Katrina?
You know, the kids in New Orleans are a mixed bag. Some are doing really well. We just did a program at the Louisiana Children's Museum called Katrina Voices, and it was all about resiliency, and the young men and women who participated really are doing well considering everything that they've gone through. There's also a large number of kids who are not doing very well. They're still struggling. They still have difficulty with making it through school, kind of finding their way in the world, and struggling with who they are and memories that they have of losses.
So can you tell me about the signs and symptoms of post-traumatic stress disorder and what parents should be looking for?
Sure, parents should be looking for kids who might be more tearful, who might be more anxious, who may be having trouble sleeping or even eating. Depending on the age, sometimes the symptoms are a little bit more extreme. Sometimes they are just kind of subtle changes in their behavior. Also, you know, for a lot of kids who experienced Katrina, at this point in time, hopefully someone has actually identified that they're having difficulty with their reaction to the storm, and that those kids have been pointed towards, you know, assistance.
And how do you find somebody? You said if you notice some of these signs and symptoms, what should a parent do?
Sure. depends on the parent's resources, of course. You can definitely go through your pediatrician to get a recommendation. Your health insurance provider will have a list of folks that you can see. But if you really don't feel like they need professional intervention or you want to start at home, there are some nice websites that can give you ways to talk with children about all sorts of difficult situations. The National Child Trauma Stress Network has a website that gives you talking points and also suggestions of action for not just hurricanes, but for any kind of natural disaster or human-made disaster, such as shootings and things like that.
Right, because we've had a lot of things in the news, not just the shootings, but there's been floodings, tornadoes, all sorts of natural disasters. So what's the website again that our audience can go to?
It's nctsn.org. Okay. The other thing that I tell parents a great deal of the time is to have a plan and talk about plans with your child or your children to help them feel a little bit more secure that if something happens, I know what we're going to do. Having a hurricane preparedness plan, we say that all the time. But really, when you sit down and do it and you include your child in that conversation, you can really get a better idea of what your child's concerns are. And also it gives them a sense of predictability and controllability, which is really important when you're dealing with any kind of anxiety. So they can say, I don't want to go to grandmom's, I want to go to Aunt Susie's or something like that, or I want to make sure that you have checked out how we get onto the city evacuation buses, Mom, so that they know we have a plan and it's doable, and I know what I'm going to take with me, and I know that we're going to be together.
Giving them a little bit of self-control.
Exactly.
Well, thank you so much for providing this valuable information right as our anniversary of Katrina comes up here.
Thank you for having me.
When we come back, we'll be speaking with American Heart Association representative, Dr. Donald Adams, a neurologist with East Jefferson General Hospital, who will talk about the incidence of stroke in post-Katrina New Orleans. So don't go away. We'll be right back with more Community Health Heroes.
Hi, I'm Kathy Ireland. I enjoy great careers in fashion, design, and business. The most important responsibilities to me are being a wife and mother to my family. We all need to be here for our families, so please let's do our best to stay healthy. And at my age, that means getting screened for colon cancer. Colon cancer claims the lives of 50,000 men and women each year, but it doesn't have to. Colon cancer can often be prevented or caught early through screening. If you are 50 or over, or have a family history of colon cancer, please talk with your doctor about getting screened. It could save your life. I got screened. Did you? For more information, please visit screenforcoloncancer.org. Thank you.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Did you know that according to the research presented at American College of Cardiology's 62nd annual scientific session, New Orleans residents continue to face a threefold increased risk of heart attack post-Katrina, a trend that has remained unchanged since the storm hit in 2005. Joining us today to talk about the incident of stroke in post-Katrina New Orleans is Dr. Donald Adams, neurologist and director of East Jefferson General Hospital Stroke Center. Welcome to the show, Dr. Adams. So you're the director of the stroke program at East Jefferson Hospital.
Oh, that's right. The community of the United States has encouraged people to build stroke centers in major hospitals really all over the country with the idea of improving access to good stroke care and timely stroke care. So we're one of 5 or 6 programs with that designation in New Orleans.
Well, that's awesome. So what does our audience do if they want to know the signs and symptoms of stroke, and then how quickly should they get to the appropriate setting?
Most people, as they get older, have had a relative or a friend or someone who's had a stroke. So threatened strokes or beginning strokes look pretty much like what you're used to seeing in the past. It's worth remembering that one side of the brain is affected typically, the other's not. So you're always going to have one side of the body normal and the other is impaired. So you see symptoms typically affecting half of the body. The face becomes drooped on one side. The person can't pick up their arm and use it normally. Their speech becomes garbled, or the words don't make any sense. Or they can't walk and they're dragging a leg or something along those lines. The problem with getting people really state-of-the-art stroke care has mostly been that people tend to say, I'll just stay home and see if it goes away, which obviously usually it doesn't. For every minute that the brain has lost blood flow, you lose about 2 million functioning neurons. And after about 6 hours, there's nothing you can do about it. Really, after 3 hours, there's very little you can do about it. And that leads to the fact that stroke is the leading cause of adult disability. About 4 million people, 5 million people live with the effect of that. So if people were aware of the idea that if something like that happens, I need help and I need it immediately, sort of like crushing chest pain brings people to a hospital, we could do something about it in really a much more effective way than we do now.
So time is really of an essence. When you're having those one-sided symptoms, you should really call 911 or get to your emergency room as quickly as possible.
Exactly, and the EMS services in New Orleans and the area are very good and very sensitive to the idea that you have to show up and you have to do something about it right then. So if you think about it, time is brain, time is critical.
That's very good. Time is brain. I like that. Now, after Katrina, do we see more or less strokes?
We saw a lot more strokes and heart attacks in general. Stress, anger, very emotional situations are more of a trigger for heart attacks than they are for strokes. But in some parts of the area, the other thing that happened is a lot of younger people or middle-aged people left. And the main risk factor for stroke is how old someone is. So as the population has aged, we see a lot more strokes.
So we really kind of biased who we're seeing. A lot of the young folks relocated and some of them didn't come back, and it kind of left a lot of our seniors still here.
Exactly. Probably half the people who have strokes are 80 or older.
Okay.
And in some areas of New Orleans, the population is older.
All right. And what can a person do if they want to help prevent the risk of strokes and heart attacks?
The main aspect is like most other things in medicine. It's a healthy lifestyle. At the turn of the 20th century, 1901 let's say, the average life expectancy in America was less than 50. We vaccinate people, they eat better, they stop smoking. Now the average life expectancy is close to 80. Medicine has a fair amount to do with that, but an awful lot of it is just people take better care of themselves. So if you have access, you can go to the American Heart Association or the American Stroke Association websites, which really tell you a lot about that. Oftentimes I think Americans spend more money taking care of their car than they do themselves. So if you find and treat high blood pressure aggressively, 25% of people with high blood pressure don't take their medications in general, or diabetes, or if you stop smoking, or if you just focus on the idea that I don't want to be disabled as I get older, I need to take a little better care of myself, that really ultimately is the main thing, and you can educate yourself by using the online resources. Unfortunately, about 2/3 of people who have strokes don't have any warning. It happens. So if it is happening, it's critical to get to an emergency department as soon as possible in a stroke center. We have plenty of them in the city. And it's critical to be aware of the things you can do to bring your risk down. You can't stop getting older, but you can certainly treat your blood pressure or your diabetes or not smoke in a much more effective manner than many people do.
Right. Well, I really appreciate you taking the time out of your busy day to be on the show.
My pleasure. Thank you.
When we return, we'll be talking with Dr. Keisha Davis with the Louisiana Department of Health and Hospitals about the Shots for Tots program. So don't go away. There's more to come on Community Health Heroes.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
Did you know that Louisiana has some of the highest immunization coverage in the U.S.? According to United Health Foundation's 2014 America's Health Rankings report, 69.1% of our children are covered and 72.6% of our teens are covered. Joining us today from the Department of Health and Hospitals to talk about the state's Shots for Tots program and the importance of immunizations is Dr. Keisha Davis, Louisiana Department of Health and Hospitals Assistant State Health Officer and Chief Medical Director for the Office of Public Health. Welcome to the show, Dr. Davis.
Thank you for having me, Dr. Walker.
So you have this really awesome program called Shots for Tots. Can you tell me about that?
We do. Shots for Tots is Louisiana's way of educating parents, educators, interested stakeholders about immunizations. The schedule for required vaccines has gotten so complex.
Yes.
That we have a community consortium that really focuses on what vaccines are needed for children under the age of 2. Shots for Tots was started in 1992.
Wow, it's a long time.
It's been a long time. And what this consortium does is really provides information so that individuals can make informed choices about the vaccines that they need and their children need.
So it's mostly a program for kids under the age of 2 to get all those very important early vaccines?
Yes, as we all know, for our kids under the age of 2, there's several vaccines that are required for them to really prevent them from getting diseases that we haven't seen in a long time here in the U.S. and used to cause a lot of death in children.
So what shots should a child have before they enter school?
Well, it is a very complex schedule, and for school, there are really 3 major areas that Louisiana legislation requires vaccines for. The first is for children under the age of 4 who are either entering pre-kindergarten, daycare, or Head Start. The second area is for children over the age of 4 entering kindergarten, pre-K, daycare, or Head Start, because they still can enter those institutions at that age. And then for those kids who are entering 6th grade at the ages of 11 to 12. Because the schedule varies based on age and there are always additions being added by the Centers for Disease Control, we recommend that parents talk to their own healthcare provider about their child's requirements. But there are things like protection against polio, measles, mumps, rubella. Those shots that we remember getting as children are still on the schedule, but there are also some newer shots that have been added for things like hepatitis B and meningitis. The best place for a parent to go is to their own healthcare provider for specific information for them.
So I understand there's not really an app to help parents remember what shots their child needs, but I think there's some kind of registry or something?
Yes, there is. So we don't have an app just yet, but I'm sure we're heading that way. We do have a program called MyIR, or My Immunization Record, that parents can sign up with their healthcare provider at our local parish health unit to be able to access, their own immunization records. So as we're entering school entry time and we need to have verification of those immunizations, they can go online and access their own immunization record for themselves or their children, and also see what the forecast is for what may be needed either now or soon.
Because things change, and that's a way a parent can stay up to date.
That's a way that a parent can stay up to date about their own personal record and that of their children.
So it's MyIR?
MyIR, and again, they can talk to their own healthcare provider. If they don't have a healthcare provider at this time, they can find some information about it at our website, theshotsfortots.com.
Well, that's very cool. Now, recently California passed a law that states that kids have to have their immunizations whether the parents have personal or religious beliefs. Can you tell me about that and what Louisiana might be doing?
Yeah, so California removed a lot of the exemptions that previously they had in their laws. Louisiana currently does maintain 2 major exemptions for vaccination requirements for school entry. That's for religious or philosophical beliefs. In Louisiana, all a parent has to do is file a written requirement that they do not want their child to have certain vaccinations. That is filed with the school. It's not filed with the state or any other healthcare provider. It's directly with the school. And really it's there to protect that child the classroom and the teachers if there's an outbreak, that we can have that child notified and have that child removed from the school so that they're protected from that disorder or disease. In Louisiana, we have very low exemption rates, 2 to 3%. So I think we're doing a really good job of protecting all of our children, our health care providers, our schools, and our classrooms from these vaccine preventable diseases. So we don't see a need to actually change the law at this time like California did because we have such low exemption rates.
It's not as bad as it is in California.
No, it isn't, and we have really, really good immunization rates in Louisiana, and so we're doing a good job through Shots for Tots program, providing the education to parents, and parents are getting the kids immunized.
Awesome. And if I wanted more information or our viewers need to find more information, where could they go for that?
So we always like to direct our residents back to their healthcare provider for that very specific information for them. However, if they don't have a healthcare provider or just want general information about the immunizations and the schedule, they can get that information at shotsfortots.com.
Awesome. Well, I really appreciate you sharing this valuable information with us on the show today.
Thank you so much for having us.
And we'll be right back with more Community Health Heroes.
2 outs with a runner on first base. Now the big guy comes up with that, hitting .342 with 92 RBIs and 36 homers.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov. Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away. Community Health Heroes will be right back.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this on line.
I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
Hey, she took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
Joining us for today's Eat Fit NOLA cooking segment is Molly Kimball and Chef Johnny of Ushi Sushi, who's going to prepare sushi for us today. Thanks so much for joining us on the show today, Johnny and Molly.
I'm very happy to come over here with Eat Fit NOLA.
Yes, very excited.
I prepare something for, for the healthy food. That's why I make one salad and sashimi and one roll with the raw rice. And some people of American, they love it easy to chew with the soybean wrap. But with me, I like it the seaweed better.
Okay, so you brought us a couple different wraps.
Yep. Okay, now on, I make the salad for you first.
Okay.
And usually, we enjoy the salad first, and after that, but it usually I make it very light soy sauce. I really don't like it, too salty, and because not too healthy for the anybody. And that's why I like it, very light. This one, the salad, only crab stick, avocado, mango, and the seaweed, and a little bit smell roll.
A little bit of the smelt roll, which we have up there.
That's the smell roll right here, yep.
And this is also cucumber in there, right?
Yeah.
It almost kind of has like a pasta type texture to it because it's these ribbons.
So what are the ribbons made out of?
Cucumber.
Cucumber.
Oh, wow.
Right.
Beautiful.
The cucumber, I cut it, it's very, small, and chop them out, look like a noodle.
So some of the criteria that we use with Eat Fit NOLA is no white carbs at all, which would mean no noodles. So he's made, kind of a noodle-like texture out of these cucumber, and everything cut in here kind of gives you that flavor, that texture. So no white carbs, low sodium. So that's why he said just a tiny bit of sodium, so we don't have a little bit of soy sauce, so we don't have a whole lot of salt. And then very, very little sugars. And so all the things that Johnny's making today are part of the Eat Fit NOLA menu that we developed with him. So basically we took a lot of what he had already and kind of tweaked it a little bit to make it Eat Fit NOLA.
So you didn't have to completely take out all the fun out of the sushi, but you were able to make it light by lowering the sodium and lowering the carbohydrates.
And you've got the same things at the restaurant, and we've got the menus that when you sit there at Uchi Sushi, it'll be right in front of you of here's how to order Eat Fit.
Awesome. So tell me about the roll you're going to make. It's absolutely
now
beautiful.
I make the roll with the round rice for you, and they support it, with Japanese style, and they like it the seaweed outside. That's why I make it seaweed outside, a little bit small roll.
So again, just brown rice. And automatically when you order the Eat Fit NOLA menu at Uchi Sushi, it comes with brown rice. So it makes it easy for people.
You don't have to make that decision.
Yes.
So some of the mistakes people make in thinking sushi's healthy are that they're choosing the white rice over the brown rice. And what other mistakes are there?
Well, like Johnny says, a lot of people come in and they think they're healthy, but then it's tons of white rice, soy sauce, drowning it in soy sauce.
And then a little too much sauce is poured on top?
Exactly. What do you see people do a lot? They think they're being healthy.
If you want to be healthy, you have to eat on time. Exactly about on time.
Okay.
So kind of setting a schedule for yourself.
Yeah.
Not starving, like you don't come in starving, you only eat too much.
Yeah.
And I think you also serve your sauces on the side, correct?
Exactly.
Instead of drowning the roll in a bunch of sauces, you dip them.
Exactly. And then when you see, as Johnny's cutting this, it's still so beautiful. So I think a lot of times when someone says, okay, I'm going to try to do the right thing if I'm going to Japanese, not do the white rice, a lot of people, the default is sashimi, which is delicious, just the raw fish, no rice. But sometimes then you're kind of missing out on this combination of different textures and fish. So when you look at all the beautiful fish in here, the avocado, you've got still the treat of all those different things happening in your mouth. It's not just the fish.
And if we wanted to find out more about your restaurant or where you're located, where would we go?
My location is 1521 North Scotway. And the phone number I don't forget.
Are you open 7 days a week?
Yeah, I'm open 7 days a week. It's open 11 o'clock. In the weekday to 10:30 we close, and the weekend it 11 to 11:30 we close.
Well, Johnny, this is, go ahead, Mom.
Delicious. I was going to say, we live right around the corner from Uchi Sushi, and we can walk there. So many, many times we get this for dinner, and then we order extra from Johnny so that this is also breakfast. So it's delicious.
Very healthy choices, and it's absolutely beautiful.
Perfect.
All right, well, I really appreciate you both being on the show today and showing us how to not only choose delicious sushi, but even if somebody was brave enough to possibly make it, and definitely visit Johnny at Uchi Sushi. So join us next time for another great Eat Fit NOLA cooking segment. And don't go away. We'll be right back with more Community Health Heroes.
My mother shaped me as an actor, as a musician, as a human being. So when she was diagnosed with colon cancer, it was like our entire family got cancer. And she died when she was only 56, so this is personal. And hopefully my heartbreak is your wake-up call. You can prevent colorectal cancer. If you're 50 or older, get screened. Screening saves lives.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website, www.communityhealthheroes.org. We hope that the information provided today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.